Right. Good afternoon, everybody. I am going to make a start and start the introductions. We've only got an hour, so I'm delighted that so many of you were interested in today. Very briefly, before I go into the housekeeping, I'd like to introduce myself and let Amanda introduce herself, who is also going to be co-delivering this webinar with me today. So first of all, just myself, my name's Heidi Surridge. I'm a research manager with part of the National Institute for Health Research called the NIHR Evaluation Trials and Studies Coordinating Centre, so NetCC for short. And as you know, and I'm sure many of you do who've come in contact with the NIHR, we love our abbreviations and acronyms. So, but what we do at that coordinating centre is we manage some of the research programmes that researchers apply to. And we involve members of the public in different aspects of our work, sitting on our committees, reviewing application forms, and obviously there's a huge amount of members of the public involved in the research that we fund out there. So welcome all of you today. My focus in terms of my role as a research manager is patient and public involvement, and it has been for well over a decade. So I'm delighted so many of you can join us, and we'll find out a little bit about you in a moment. But over to Amanda.
Hi, I'm Amander Wellings, probably going to be joined by Rover Cat if he appears. I've basically been doing patient and public involvement work for about the last 18 years. It became my passion. I've got Asperger's syndrome, so part of it became my passion and my sort of probably my specialist subject. I don't know, but so I've sort of thrown myself into loads of roles that normally I wouldn't have felt comfortable in. So it's been really good for me. But I was the actual co-author of the original Co-Applicants guide when I was part of the Involve advisory group, and I'll talk more about that later.
Okay, thanks, Amanda. So we're going to do a double act, and we've agreed that if we see timings going awry and that kind of thing, we're going to butt in on each other. So we're not being rude. We do know each other quite well. So bear with us on that one. Right, just a few housekeeping things before we keep going. Our apologies. We were hoping that we would have Dr. Susie Hopper with us today, who is one of our senior managers for one of the research funding programs. Unfortunately, Susie's unwell. She can't join us. However, I spoke yesterday to our assistant director who manages the application and the funding processes, so the committees and that, for our part of the NIHR, and she's going to be very interested to hear the feedback and the questions that come out of today so that we can have a continued dialogue around this. Okay, so sadly not with us, but we do have links and we'll feed into that part of the NIHR. With popularity comes limitations. This idea was generated locally down here in the Wessex region, which is kind of South Wiltshire, Hampshire, Dorset kind of area, but word spread quite quickly. It does in these virtual times, doesn't it? So I believe we have quite a few of you from all over the country, and maybe potentially wider. So we have potentially a lot of people joining us, dropping in and dropping out. So the initial discussion format that we had can't quite be the same. However, we're going to try and make it a little bit interactive and of use to you guys today. So what we've got some polls, and we would very welcome your questions in the chat function. If we don't get round to answering them, we are going to look, Amanda and I are going to go through that chat function afterwards, and we'll produce a response paper to that, and we'll make sure that with the recording and the chat and the response paper is available to everybody. Once again, the slides will also be available, so you don't need to try and write any links down or anything. So listen, enjoy, and contribute as you can in the chat. Now, given the way we're doing things, it's very hard for Amanda and I to monitor the chat. We've got colleagues doing that. We can't cope with the raising hands as well because of so many people joining today, sadly. So we have taken on board and kind of given things a little bit of structure around some of the questions that people could submitted before you joined us today. So we hope that it does address some of your concerns as we go through. We are recording because we've had quite a few requests from people who can't join us today, and otherwise I really do hope you enjoy your time with us. Okay, so very quickly, we just want to get a gauge of everybody out there. We'd ask you to keep muted unless you're talking, obviously. And if we start to lag a bit, I'm going to ask everybody who has their cameras on to switch them off, because it does sometimes help, although it is lovely to see you. Okay, so Katie, if we could have the first poll, please. Okay, so we just want to get an idea of who's out there, of the 86 of you who've joined us. What best describes the hat you're wearing coming to this event today? So we are almost at the number of attendees. I'm going to wait just a few more seconds. I think we'll go with that. Katie, can we end the polling, please, and share the results? Okay, well, actually, it's absolutely lovely to know that we've got a lot of the terminology varies, doesn't it? PPI reps, public contributors, lay, whichever term you're using in terms of your involvement, that is absolutely fantastic. We've got so many of you listening in today. Some PPI leads and facilitators. I think you are the guys that get so many of the questions about public co-ops, and it's lovely as well that we have some representatives from the research community, and I know some researchers have got in touch to say, can they listen to us afterwards? Okay, can we have the next poll, please, Katie? So just a quick one, because this was initially a regional webinar today. We're having to go, as I can see, most of you are from elsewhere. Give us an indication of where you're from. Okie dokie. So 12 are relatively near me in Southampton. Elsewhere, if you could jot down in the chat where you're from, that will really help us get a gauge of our reach today. So that would be very useful for us. Okay, Katie, we can stop the poll there for now. Thank you. Okay. So, on with the show. We don't want to go through the guidance today. However, the journey to the guidance is quite interesting. Amanda.
Yeah, as I said previously, I was one of the co-authors on the guidance and the only public co-author of the guidance. Why the guidance happened was way back when I first joined Involve, the NIHR group that helped to facilitate patient public involvement. I noticed loads of unfairness and injustice and just lack of understanding of the roles, responsibilities, and around responsibilities if you signed up as a co-app. I was actually signed up as a co-app on an application that I hadn't even seen, and it went to funding and it was turned down, and things like that. And also anecdotal evidence from people that said, well, they've been put on as co-app and they hadn't actually been contacted by the research team. So things were pretty bad then. And having Asperger's, I hate injustice, I hate unfairness, I hate people being used. That's just part of one of the things that really, really bugs me. And I hate working in that situation. It just makes me feel so uncomfortable. So I wanted to help address this. I was part of the Involve advisory group, and we used to have open sessions in meetings. So I brought this problem to an open session. And it ended up that Jim Elliott, who a lot of you know through patient and public involvement things, he's actually part of the Health Research Authority now, but he was part of Involve then. He sat on my table with me all the time, and we went through the problems as we saw them. And then I wrote a paper, and then I waited a long while. So then we picked it up again with Involve, and we had scoping meetings to discover what the problems were and what people thought the problems were around co-applicancy. And we had a team that formed, and they reviewed all the documents and what we were producing. So then working alongside the Health Research Authority, which Jim Elliott was then part of, and the Research Design Forum, it took about 8 years to actually get this guidance to go live. So, and I'd also like to thank Martin Lodemore, because he used to be part of Involve, and he, as part of the learning and development work, which I was part of that team, yeah, we really, really strove to get this out there, mostly to just answer the questions that everybody had, because this was new. Co-applicancy was new. We didn't really know where we were going with it. And I needed that certainty, especially as a person with Asperger's. I don't like uncertainty. So I knew if I needed that uncertainty answered, there must be other people out there that did as well. So we produced the guidance, and this version has just been reissued very recently, and I was part of the rewrite of the new document, which is now on the Learning for Involvement site, and is part of the new resources from the Centre for Engagement and Dissemination. Thank you, Amanda.
That's brilliant. Okay, so we won't, although it's a good read and it's an easy read, we won't linger on the guidance now. One of the questions that came up more than once from those of you attending today, and also some of the queries we've heard anecdotally, is it really something that should happen on all research projects? Should there be a public co-applicant? We'd like to know what you think here. So Katie, if we can have the next poll, please. So will you get brownie points from, obviously I'm from the NIHR, so I'm particularly speaking of that in terms of funding, but we could well put this across to other funders, although you have to look at their information. But will you get brownie points if you've got a public co-op from the perspective of the research funder? Okay, we're going up in numbers. Anyone for any more? Leave it for a few more moments. Anyone else? Okay, Katie, let's close. Right. The most popular answer is yes, but it's pretty much of a split. There's a bit of a maybe there. And 8 people think no. Okay. Okay. Formalities wise, hang on, just going to close that. There is no formal requirement by the NIHR to have a public co-applicant as part of the research team. However, we fully recognise the benefits that they can bring when involved appropriately. Where they are going to be involved, we want a clear description of what they will do and why, that rationale. Why will they add value to joining the research team? And also, we stress that this shouldn't just be the be-all and end-all of patient and public involvement, your public co-op. There needs to be PPI threaded through appropriate places in the research. Did you want to come in, Amanda?
Yeah, I'm looking at the chat and there's loads of little questions coming up saying what is appropriately. And for me, I think some projects just aren't big enough, really. They're small projects, and to have a PPI co-op will probably be a little bit hard on the financing of that project to actually support somebody to do that role. So I think if it's a small project, they're better off having a PPI group and PPI embedded in that way. So that's one of the reasons why having a co-op wouldn't be appropriate. Appropriate is, it's in the eyes of the researchers and what the person will bring to the team. And in the eyes of the person who's going to be the co-op and what they could bring to the team, because they'll know if their role is appropriate or not when they're signing up to do it. So it's kind of, for me, it's an innate feeling. I know when a project should have a co-op. It just feels right. It's a sort of well-funded project, and there's room to have somebody at that level, and if the roles are written well, as Heidi says, and whatever, it works really, really well. And as a reviewer, I can see where a co-op is good in a project, and I can see where a co-op is not actually necessary some of the time. But there's no right or wrong answers here. It all depends on the situation.
Yeah, and I think there's talk in the guidance of avoiding tokenism. And you know, PPI is so, patient and public involvement is so well established, particularly within the NIHR, but within the research communities. And over the last 15 years, we've seen a great push and a great change. We still have ways to go in some areas, but I'd like to think our committees, our reviewers, they're not daft. You know, we see so many at the committee settings. They can tell if a public co-applicant is there, is supported, is going to add strength and add value to the research team. Okay, another question that came up was, what's the difference between being a public contributor, a PPI rep, somebody involved in a research study as a member of the public, or a patient, or a carer, or service user, the list goes on, and that public co-applicant. So I believe we have a poll. Okay. Oh, that's the PPI Leads one. Katie, can we stop that one? Although everyone's jumping on it, we'll come to that one. Sorry, my apologies. Okay, the public co-applicant role is one of the roles that a member of the public can take on. It has responsibilities associated with it. You have a commitment. It's a longer term commitment. It is also a formally recognised role. Although you are very much appreciated and part of a study, and that as a public co-applicant, you are a member of that research team. You are there to see that project through from start to finish. And as a public co-applicant, you're not just there for Christmas, you're there for life. So a public co-applicant then becomes that public research team member for the duration of the project. Amanda, do you want to?
Yeah, it is a different role, and I think it's being embedded in the research team. You're there at all the team meetings, and you're there as a joint member of the team, an equal member of the team. Whereas with if you're just being I say just, that's not belittling it. If you're being a PPI representative on an advisory group or as a PPI representative, it's different to being that embedded in the project. You really get an understanding of what the project's about, and you get to do your role, yeah, as an equal member of the team. And that's the difference, I think. And it's not that onerous. I'm reading the chat. I always do this, and it's kind of strange. It's not that onerous being an equal member of the team, but there's also a lot of support and a lot of infrastructure that's needed there to help people to perform that role. And everyone said, I've seen in the chat that people are asking, what training can you get to do the role? Well, I see a lot of mentoring people in PPI. So they learn about PPI, and then after they've learned enough, they then come on and they can take co-applicancy roles. But that's just my view, and that may not fit everybody. And as I say in all these things, all I bring is my view. I see it from my perspective, and that might not be popular with everybody, but that's just how I've lived it and how I see it.
And I think we will get into a little bit of, you know, to contract or not to contract with a public co-op, and the support and the training availability. And a lot of it has to do with the relationship with the institution and the particular higher education institution that the research study is hosted within, or the hosts of the research study, and the available and support that can come with that. I am getting a bit laggy, so if possible, could people switch their videos off just to help us along the way here? That'd be great. So yes, right, moving on. So why have a public member of this research team, a public co-applicant? So a little bit of, it's kind of extrapolating from why we have public involvements. In that research team, throughout the duration of the life cycle of that study, you've got someone there that has walked the walk, who's got that lived experience of the people that you're intending, the researchers are hoping to benefit, the people that they want to take part in the study. And also you've got that, and I've put but why there, and I always think of it because it's my mentality, my toddler mentality, but it's somebody who comes in and says, well, why are you doing it that way? That critical friend. And just to ask what's it, the elephant in the room questions, Amanda, yeah?
Yeah, I love the elephant in the room. I mean, produced involved guidance for new people coming in, and there's actually a picture of the elephant in the room. I think what a lay co-op can bring to the team is an independence and the role to be sort of free to bring up the elephant in the room that sometimes members of the research team don't feel that they have that freedom to do that. Yeah. And I mean, yeah, as a lay person, I always ask the awkward questions. I always bring the elephants in. I'm known for that, and I'm known for questioning everything that I don't feel seems right, and also praising everything that I do feel is right. So I don't just bring a critical friend, I bring a friend as well, and hopefully good person to work with in the research team.
Yeah, and I always like that term. It takes the researchers out of a potential bubble. You know, not everybody's in that bubble, but it grounds it back into that reality of what we're trying to do this for, and brings them back. I always look back to many years ago from the fact that I was actually a researcher back then, and I was working particularly in dermatology, so eczema and children, and there's an example I use of a dermatologist being particularly interested in a new eczema cream and the effects of it, and what would the benefits and those outcomes be if it was a success. And you know, maybe the reduction in redness of the appearance of the skin, maybe in the reduction of the spread of the eczema across the child's body. When Billy's mum, I'm sorry, but all I'm concerned about is the fact that Billy sleeps all night. And that really kind of, for me, brought home the fact that, you know, I don't care if I can see the eczema, mum, and Billy's 3, he doesn't care. But what we do worry about is the fact that he can't sleep. We're waking up with blood on the sheets in the morning. The itch is driving him impossible. We need something to help with that. So that's that grounding, I think, and that questioning, and that sort of, why is that going to be useful? What does that add?
I think it also adds I see part of my role as building bridges between service users and researchers. So part of it is coming at it from either someone with a lived experience or someone with service use of other kinds. Being able to sort of share what's going on in the research and get people involved in a way that they feel comfortable being involved. So yeah, and I know bridges shouldn't be needed. They're not always needed, but sometimes there is just still this wariness from the public about being involved in research, being asked to give their opinions. Are their opinions valued? And part of that is just, it's breaking down those barriers that have been in PPI in the past, and recognizing everyone's value in the team, and yeah, just hopefully helping people want to become involved as well.
Yeah. So if you want to be a public co-applicant, or if you think maybe having a public co-applicant on your team might be the right choice, the right idea, you got to think about it. You've got to plan. One of our PPI leads mentioned to us in the questions beforehand, there's no point coming 2 weeks before you intend to submit your research application and think, do you think I should include a public co-op? It needs thought, it needs pre-planning, it needs thought of, why do I want to involve, what value could we potentially add, what support could we offer, can we be creative enough with our accounting to support them in that co-applicant stage before we get funding? What are they going to be expected to do? And that's something that you could co-produce with your potential public co-applicant, if you know who might be involved in advance, and that's an if we'll come to. Working with the host institution, as we've said, there's legalities and contracts, and I think Amander and Mo can speak about that. But also, it's not a role for everybody. Not everybody wants necessarily the responsibility or the formality associated with it, and different types of involvement suit different people. So it's not something anybody has to do. Amanda.
Yeah, I think the host institution part of it is whether the host institution is geared up to support lay co-apps, whether you're going to have a contract, who the PPI team are behind you. So that makes a lot of difference. And if they are geared up and they are really passionate and have a good track record of PPI, they're probably more likely to be able to co-create PPI with service users and have that dialogue about what you feel your role could be in the team and what your strengths are and what you will bring to the research, which then when it comes to funding, you can actually see the clear role. And yeah, it is flexible because you get in the middle of the research and you realise that some of the things you may have said that you can do are not possible, so you change things and but that's purely that's while you're working as a member of the team. So yeah, all roles are flexible, I think.
And Diana, no offence. It's no offence taken. It's actually my poor spelling, and I should learn to spell check. So thank you, Amanda. Okay. Right, now the thorny issue around the differences between a public co-op and a project PPI lead. Are they one and the same? Are they different? Can we have that poll now, Katie, please? So do you think that public co-applicants should be the PPI lead on a project?
Sorry, Heidi, it's Hamid here. It's quite a tricky question because, but I won't share my thoughts until you say go ahead, because I don't want to influence the poll.
Exactly. And you're right on it there, Hamid.
Yeah, I'll come back to it.
I didn't say it wasn't a trick question, Tess. Shush. No, go on, go ahead.
Heidi, is it a trick question? I think it's a really difficult question, and I almost don't know how to answer it without the context of a specific piece of research.
Yeah. Well, I'll have a bash, and then we can, if we'd like to, Amanda can give an example, or if you have one, we'd be interested in hearing. So can we end the polling now? Lovely. Okay. So are public co-applicants the PPI lead? 6% say yes, 42% say no, and maybe there's 52% sitting on the fence. Okay. What I'd say here before I hand over is if they have the interest, the skills and the knowledge, and potentially the contract and the backing and the support of the institution to support the planned PPI from design to impact, then yes, if they want to. Ooh. Is everybody still there? Because my link's gone.
Yes, we are here.
Lovely,
Yeah.
thank you. Apologies. All the cameras just suddenly, your faces went, so my apologies. The PPI lead, however, is poll down
I think it's Heidi that's having difficulty. Are you still with us, Heidi?
You're on mute, Heidi.
Is it Katie's slides, possibly?
Hello, can you hear me? And now.
Yeah.
Yeah, super. Sorry about that. For some reason, I was muted, so I think my internet's a bit dodgy. It's the joys of when you have a crucial role in something like this. So my apologies. Okay. The NIHR do define the role of the PPI lead. Now that can be any member of the research team. It should be somebody. We will share this link again afterwards, but I'm just going to return.
Heidi, just to let you know, we can't see your slides.
Yeah.
Oh, gosh. Katie, do you want to share the slides?
Sure.
Thank you. I'll stop sharing if I can. Maybe it's because I lost my internet connection momentarily. Thank you, Katie. Okay, so if we could, yeah, so the PPI lead could be another member of the team if they have the skills and abilities. And I think Amanda's got a good example of this.
Well, I work in the public health intervention responsive study teams on the NIHR. I'm a co-op.
Nice to meet you all. Bye-bye. Bye-bye.
Goodbye.
Yeah, I'm a co-op in one of the firsts. And how we set those up, or how we set ours up, which is based in the University of Hertfordshire, it's the central first, is we set it up because we have someone in the University of Hertfordshire who is lead for PPI across the whole of the university. And so she provides a supportive and PPI lead role, and I help her with that. So basically we split the PPI lead. I do some of it, she does some of it. And it really works well because I feel supported in that role. I don't feel like I've been dumped into something that I necessarily would be uncomfortable doing. So for me, it's a nice way of doing it. I mean, I probably could take it on, but I wouldn't feel as happy doing the role if I didn't have that support of Julia and the team around me. But that's just my personal experience again. I know some people would probably feel that they're ready to do that role and they want to be the PPI lead. But if I was reviewing an application, I'd look at what that person's background is if they're taking on the PPI lead, just to make sure that they're not being dumped in or they're going to be able to do the role. Yeah,
and I think that role can easily be shared. And the idea is not to introduce complexity. It's the idea is that the PPI lead is there because there needs to be a named contact, a named organizer and supporter for the patient and public involvement in a project. There mustn't be any ambiguity there. There's a duty of care and a duty of support and training for the people that you are involving in a project. Diana, interesting question. What would you see in their background? Who is a public co-applicant? We all would bring different things to the table. And it is kind of like a bit of a triad of what the research team and the institution and the project topic and the public co-applicants can offer. So, Diana, I don't quite understand the more equal than others.
Sorry, Animal Farm. Some pigs are more equal than others. This seems to me to be a judgment being made that is made on somewhat shaky ground. Sorry to interrupt.
That's all right.
No, I'd never judge someone's ability to do the role.
No.
I don't do that. I'm not set out to judge people as to whether they can do the role or not. I'm just saying it would be, I wouldn't like to see people taking on the role if they didn't have the background in PPI to be able to perform it. That's my concern. So that's where I'm coming from. I'm not coming from it as judge, because that's what I do. I believe that everyone should be equal in everything that they do. So I'd never come at it from that perspective, because I agree with fairness, justice, as I said in the beginning of this. So.
Okay, we have a quick question here from, not necessarily quick. She's confused. Are we referring to the PPI lead in a research project as the PPI spokesperson? I thought the PPI lead have to have specific PPI training, a formal institutional role. There are PPI leads who have institutional roles. We have many of them on the webinar today. But in terms of a research team on a project, we specifically ask that there is a named member of that team who is the point of contact, the organizer, for the public involvement aspect of this particular project. So like you'd have a statistician looking after the data analysis, or qualitative researcher, but those activities that come under the PPI lead role can be split between two members of the team if that is more appropriate. And it can be a public co-applicant who takes on the PPI lead responsibilities, or any other member of the team. And sometimes that does happen to be a PPI lead. Okay, I think we have to move on. I think there is some really interesting stuff coming up on the chat, which hopefully Amanda and I can address. Can we go to the next slide, please, Katie? So I think this is all very well linked and very timely. So what are the types of things that public co-applicants are expected to do? Now, this is a poll question, and it's tick all that you think apply. And we'll give you a couple of minutes of this one.
Sorry, I've lost the poll question. It's not on the screen.
Oh, it's come up on mine. Has it been minimized, or?
No, could you please put it up again? Oh, I've got it.
You got it? Fab.
Yeah.
It's interesting watching the the bars go up and down.
Sorry, Heidi, I'm still, I didn't get a chance. I was going to ask you when I went quiet about the question that you had about PPI lead. Can the co-applicant be also PPI lead? And I'm still, from my little bit of understanding from the involvement I've had with this kind of stuff, is that co-applicant is not always the PPI lead, because it could be a PPI lead as a full-time worker.
Yes.
Am I correct? Oh,
yes.
Good. I'm on the right tracks. Thank
yeah.
you. Thank
Oh,
you.
that's
I
fine.
feel better now.
That's fine. You are still an equal member if you don't go to all meetings. We can't always be available for all meetings, or we don't not interested in all of the meetings, and that would be that would apply to all members of the team.
Yeah, I found these impossible to answer, which is why I think it's absolutely wonderful that they were phrased in a way that makes them impossible to answer, because it all depends on the project. And no one goes to every meeting, because basically we all have our specialities. So if PPI is your speciality, you might not particularly have a role in a statistics-based meeting, because you're not going to understand it. What's the point in you being there? So these questions are really, really hard to answer. And that's what I think is the whole thing around co-applicancy. These questions, it's not a one size fits all.
But Amanda, as you said earlier, it's important that you know those meetings are going on, because this might be the time for you saying, oh, those are the themes you're going to use to analyse. Perhaps us and the PPI advisory group or whoever, service user group, should be involved in saying, are those important focuses for the analysis? So it's making sure you're in the loop, you're part of the team.
On the chat, we're coming up with co-production, and I was reading things in the middle of the night, because I always get insomnia before I'm going to do one of these things. And I think having a co-applicant leads to better co-production, because you can keep saying to the team, excuse me, have you involved our PPI team? Have you asked our lay people on the committee? Have you? So you can push the team to doing PPI in the right places and doing it well. So.
Yeah. Okay. So we're sharing the results now. So I think we've addressed that, yes, a public co-applicant or the public research team member is an equal team member. So as we say, put all meetings, all decisions, team role, we know that there's flexibility about that, but it's the principle of inclusion of everybody. Responsibility and for the success. Hello?
Sorry, Heidi, to interrupt you. Am I silly to? I'm just got this niggly feeling. Am I okay to believe that the tricky answer is going to be that all of them are correct?
No.
Okay. I was trying to be super intelligent then.
Nice try. You're nearly there. But yeah, responsibility for pre-agreed activities, that's right, whether you have a role description, but there always needs to be flexibility about that, because obviously maybe the project needs or the interests of the public co-applicant and team member may change over time. Undertake research training, indeed, yes, if you want to and it's appropriate, you want to do it, why not?
Sometimes you might be actually training your people if you're at that level that you've done PPI and you understand what you're doing. Sometimes I've done the training sessions for my team, so we're not always undertaking research training. Sometimes we're giving the research training.
Yeah, indeed. And I think I draw everyone's attention, really. Public co-applicants can be involved with collecting data. They can be interviewers. They can be involved in the design of a questionnaire. They wouldn't necessarily, unless they're qualified, be taking bloods, but it depends on the nature of the data being collected, and the indeed in some research, a member of the public with lived experience in a particular area may just the person who can connect with the participants in the study and may able to conduct the interviews with them or think those sorts of activities. Analyzes the data. I'm not saying that they should be statisticians, but they should be qualitative data analysis. But as I mentioned before with Amanda, looking at the themes, what's coming out, are we focusing on the right bits? Yeah, Amanda.
Yeah, I think that's because service user perspective is totally different from a researcher perspective. When when you start looking at what the themes might be and what might be important to other service users. So I think, yeah, getting people in when we've got anonymized data and looking at themes and whatever is really valuable.
Sure. We don't ask anybody involved in PPI, I don't think, to be representative of everybody else with that same lived experience. We're all individuals. There's aspects you can reflect on from your own experiences and hearing the experiences of others, but we don't ask, for example, our public committee members to sit on our research funding committees as representatives of lived experience of all the applications that go through. Absolutely impossible with such a huge variety. And even within a particular research topic, there are in that, you know, there's so many different aspects, isn't there?
Mm.
I agree. We're so laden with so much different terminology, Stephen. We've got somebody else on this call who I know personally really hates lay. I don't like labeling people as PPI because it doesn't make it sense if you say it out in full. It doesn't relate to an individual, but yeah, it's okay. Right. And finally, I think that last statement there, who is responsible for all the PPI planned in a study, that harks back to our PPI lead discussion. It could be, but that's a decision to be made with the public co-applicant and the wider team. It's who has the skills, abilities, and knowledge and interest in doing so. Oops. Okay, so can we have the next slide, please? Okay, now I included that in case we wanted to go through anything else. The last two are yes. They have the ability to do, you have the ability to do that to a certain extent from your own perspective, from that lived experience perspective. Do you think that what we're focusing on will be important and relevant to those people who are intended beneficiaries of a study? And I think it's really important that, you know, the members of the public that are involved in all the different aspects of a research study, commenting on design and of a research, and that they're going to know if people want to take part in a study. They're going to get a sense of the practicalities. And one of the examples I've always used is, you know, it's study asking the older generation to come to a clinic in the early mornings for blood tests 3 times a week, and their bus passes, their free bus passes, aren't valid until after 9:30 on the buses. So you're not going to get them there early in the mornings unless you find some other way of supporting them or funding them in order to get there. You know, there's some little things that actually might quite mean big things for the actual success of a study. Okay.
And I think part of the co-op role is to encourage your people that you've got working with you as service users to come up with these ideas. So part of it is encouragement and help to get people to be confident, say what they want to say in meetings and things like that as well. Can be a role for the co-op.
Yeah. Can we have the next slide, please, Katie? Okay. I'm very conscious of time now. we have gone through all the polls, just a couple of quick ones which we will actually respond to as well outside of this. How to find the public co-applicant or the research team. Now, there can be shoulder tapping. You can have a favourite individual that you've worked with over the years, but also as well as a public co-app, potential somebody interested in this role, finding out who to make contact with. There are ways and means. I'm sure everybody has heard of People in Research, where you can advertise. Anyone can advertise for a PPI or a public role. But actually, members of the public looking for these opportunities, maybe it's worth, you know, going on take part in research, or going on somewhere like the NIHR Journals Library, which tells you about all the different funded research that's going on or just about to start, and connecting perhaps with researchers in those areas and actually just dropping them a line and saying, I'm interested, not necessarily always as a public co-applicant, but because sometimes it's hard to get those networks to meet in the middle. Contracts, do you want to talk about contracts, Amanda?
I think it might be one that we field outside of this meeting. Yeah. I think part of it is just to sort of understand what you're what you're responsible for and what you're not as a co-app. So I think that's one we're filled outside, I think. Yeah.
Well, exactly. And it depends on what the host institution can provide, what the obviously it should be included in the budget if there's an intention to give a contract, what the public co-applicant intends to do. You know, if they're going to be interviewing study participants, they're going to need some insurance and support in that respect. And if the public co-applicant as well wants a contract, you know, they might be happy with those volunteer payments, and that's linked up to benefits and all sorts.
Yeah, it is kind of difficult because it all gets into the payments policy in NIHR and the payments guide, which everyone can read. But there is the thing about sort of if you're on benefits, whether or not you want to have a contract. So and that.
Heidi,
Hello?
I'm just going to make one comment. This is Peter Atkins here. I think the word contract strikes the fear of God in most members of the public.
Employment contract.
Very contentious.
Oh, sorry, employment contract. That's what I mean. A contract of employment. Sorry, lack of. Yeah, and it's not for everybody. Exactly. One of the easy things it does give you is it gives you access to, you know, some of the university services, if it's with a university, with the training opportunities, easier access maybe to some facilities and to the library and things like that, much easier. But there are ways and means around some of this, and, you know, a contract is not for everybody. Yeah, totally agree. So that there's the payments and the budgets and the legalities where we can answer some questions outside of today. We've only got a couple of minutes left. It's a relationship. All of PPI is a relationship. It's about working with people for the benefit of your output. Katie, can we have the last slide, please? So, you know, to most of these questions, and as I know, as Tess pointed out, trick questions, there's no easy yes or no answer. There's not, you know, a clear-cut defined role here, you know, and it needs to be tailored to the project topic, the potential public co-applicant that might be suited to the role or want the role, and the research team itself. And it needs to be considered as part of that wider PPI design within a project. So, you know, there's lots of ifs here. If the right person can match the right team and the right project with a clearly outlined, but again, flexible role, it can add that considerable value to the design running. And I think really crucially, the impact and the success of the research and the likelihood of its implementation and making a difference. Amanda, did you want to?
Yeah, I know we've thrown up loads of questions, and that's part of what's still out there in the world of co-applicancy. It's still in its way, it's still quite relatively new, and in the whole world of PPI always seems to take quite a while to come to answers, because like you get things like contracts keep changing and new people come along to be head of PPI, and that changes what guidance is given, and everything in the NIHR and NHS seems to take a lot of time. So it's just sort of to bear with us. We haven't got the answers to all this yet, but we're raising the questions, and we're raising the questions at a good level here, so as we can come to conclusions and reach more answers. But there won't ever be an easy yes or no answer and a clear cut sort of this is a co-op, this is what we do. And because it's all varied on the sort of research, what the co-op wants, and yeah, there's a lot of variables that you're working with.
It's a context of change, isn't it? And it's the context within which we're trying to do this, you know, kind of role and activity. But there is no doubt that it has potential to add value. We've come to the end. Thank you so much for joining us. Thanks hugely to Amanda for doing this with me today. We're very, very grateful. Thank you, as I said, all for joining us. Sorry if there's been any issues and we haven't been able to make it as quite as interactive. We could probably do a day on this. Once again, thank you. We'll get back to you with slides and with that Q&A sheet as well.